webinar is brought to you by Strategies TA and the generosity of the Office of Child Abuse Prevention. Strategies is a collaboration between the Child Abuse Prevention Center and the Children's Bureau of Southern California. Strategies is really driven by these core values. And, today we are definitely centering on equity. We are also, our work is really grounded in collaboration, accountability, community voice, and strength-based. So we're making sure that our work is really taking these values to heart and holding ourselves accountable, holding others accountable, making sure that we're listening to those in the communities that we serve, looking at the strengths that these communities bring to the work, and also making sure that we're doing it in a way that is collaborative and equitable to all. So today's presenter is Dr. Price, Dr. Jessica Price, who is an assistant professor for the College of Social Work at Florida State University. She's also the executive director of the Florida Institute for Child Welfare. Dr. Price, for the past 10 years, has been involved in multiple angles of child welfare, direct practice, teaching and training, and policy and research. She has published on child welfare topics related to training and education, racial disparity, and anti-poverty practices. She has presented her research at 30+ conferences, both nationally and internationally. She is the author of several op-eds focused on racial disparity and effective strategies to impact racial disproportionality within child welfare. Her TED Talk, which I highly recommend, on implicit racial bias in decision-making, has since been viewed over 1.2 million times. Dr. Price has worked on the front lines of child welfare, conducted primary research, been a policy advisor to Florida's legislature, and taught graduate level courses in child welfare. Previously holding the positions of child protective caseworker with the Department of Children and Families and the Deputy Director of the University of Albany's New York State Education Consortium. In 2019, she received a 5-year appointment to the advisory board of the National Child Welfare Workforce Institute, where she consults and advises on leadership and workforce interventions around the country. She currently sits on the Florida Dependency Court Improvement Panel alongside judges and advocates who are working towards a more trauma-informed approach within the judicial system. She has maintained and cultivated a commitment to the well-being of vulnerable children and families, the sustainability of the child welfare workforce, and effectively addressing inequity. Her paramount goal includes rebuilding and leading a child welfare system that focuses on strengthening families instead of pulling them apart. So we are very fortunate to have such an accomplished person here today to talk about this subject. So please welcome Dr. Jessica Price.
Thank you so much, Lydia. If I can share my screen, I'll go ahead and get started. Thank you. Okay, hopefully everyone can see that. I'm really looking forward to having this conversation today. I'm going to do this merging of child abuse prevention and racial equity in a community framework for anti-racism. Bring this back up. Okay. We're going to start this conversation with talking about what prevention really means. I just did an interview yesterday about what is prevention, and when people say it, what are they really referring to? So we're going to have a brief discussion about that. And then we're going to talk about what it takes to truly implement child abuse prevention strategies with a racial equity lens. And a starting point is leadership. And we're going to do a segment on what is courageous leadership. And then we'll talk about a mindset shift, which we touched on at the last webinar, but some of you may have missed it. And then I'll end the talk today with a framework that we're trying to build to help agencies go about building race equity and child abuse prevention. So again, what is child abuse prevention? And we're talking in the spirit of Family First Prevention and Services Act. We know that's a big piece of policy that's about to be implemented and impact child welfare across the board. It is one of the biggest changes in financing around child welfare in 2 decades, right? But it's important to know what it is and what it's not, and how it's important for leaders to be creative about how to get upstream for families. So let's just do kind of a basic, what is primary prevention, secondary, and tertiary? So yesterday when I did the interview, I was asked, can you kind of break this down? And I always think about it through the medical model. So as you all know, primary prevention in the medical model is when they're trying to prevent someone from getting any illness, right? They want you to take walks during the day, drink lots of water, eat your vegetables, do these preemptive strategies so that you don't get an illness or you don't get a disease and you don't have to go to the front door of a hospital. That's kind of the analogy, right? So what can we do? Now let's go to child welfare with primary prevention. What are the things that we can do as a system, as a society, as a community, so families don't make it to that front door of our child welfare agency, don't make it to that abuse report, right? That's primary prevention, really reorienting ourselves upstream. The Family First Prevention and Services Act really has a focus on secondary and tertiary. Now, I'm not saying it can't do primary, but really the focus is expanding the ability to use funding to prevent folks that already came in our system from going into traditional foster care. Let's go back to the medical model about secondary prevention. So medical professionals, when you come in with your illness or disease, they're trying to what? Help you heal, help it not continue to get worse. They're trying to prevent your disease from worsening. Same as child welfare. Secondary prevention is you're in our front door, you're in our system, we have a report on you. So how can we prevent you from going deeper into the system, going into stranger care, as some people are reframing, or foster care, okay? Secondary prevention. And then thirdly, that tertiary area of prevention where you're in the hospital, you have an illness, and doctors are now saying, let's try to get them whole and healed and prevent them from coming back to child welfare. Folks come in our system, they're in our child welfare system, but we meet a level of permanency and we want to prevent them from recidivating and coming back into our system. It's important as we're talking about prevention to be specific about which one we're referring to. Yesterday, I recorded a podcast and I interviewed someone here in my home state. And I said, which level of prevention is our focus? And she, in a really eloquent way, said, we are talking about all 3 levels. We're not going to focus on one. So it was important for me to understand where she was coming from and for her to clearly explain what prevention meant to her. Okay. Let's consider all of those definitions we just went through, and then let's talk about, as a leader, how you do that with a race equity lens. Okay. When I talk about systemic change, I talk about changing our system toward a prevention focus, but also toward race equity and anti-racism. Okay? So this takes courageous leadership. It takes someone standing up, someone doing what just happened a few moments ago, a leader saying, I'm going to acknowledge where we're standing. I'm going to acknowledge what happened a week ago. I'm going to acknowledge how difficult these last 3 weeks have been for a subset of our community members. Okay, that is courageous leadership, right? And that's how you start to move conversations and move systems. Let's talk about the importance of understanding what challenges and how do we distinguish between a technical challenge and an adaptive challenge. And effective leadership knows the difference, right? So technical challenges, you can address them with what you know how to do right now. It doesn't require any training. It doesn't require any expanding or trying to understand something in a different way. It's what you already know how to do. It's relatively simple. I'll use that word, right? Usually technical challenges and problems are led by folks in authoritative positions or led by management. They make a decision and something's changed. Again, relatively simple. No hassle, I'll say. The issues that come up in leadership when we're trying to change our system, right, is leaders that don't know the difference between technical problems and adaptive problems. Adaptive challenges require new ways of learning. Adaptive challenges test your habits, your beliefs, and your values. Okay? It's going to be uncomfortable when you're facing an adaptive challenge. It usually requires a level of uncertainty. And any leaders on the call, any professionals, everyone on the call probably feels like, I don't like to be uncertain, but as courageous as you have to be, you might have to be in some uncertain terrain when you're facing certain challenges in child welfare. Adaptive challenges are not led by managers or supervisors or directors. They're led by the people who have the problem. Okay? And I'll expound on that in a moment. Adaptive challenges, they require presence, time, communication, and trust. Okay? An important distinguishing this is, I'll give you a couple of examples. So I consult and talk to agencies around the country. Now here's an example of an agency that was facing a technical problem. There are statutes that say that we have to have a certain number of days where we submit abuse reports and our assessment and risks, right? There's 60 days usually, but it might depend on where you are. So there was an issue that kept coming up. Caseworkers weren't meeting this deadline. They were missing the 60-day mark and submitting things late. So what happened? The leader of that organization decided to have an internal deadline. Simple enough, right? They said, now we must have your report at 45 days. And at the 45-day mark, what do we have? We have a lot more time to give feedback and figure out how to meet that 60-day requirement. Easy peasy. That was a technical problem. The director made it a solution and it was done. Now, something else came up in this very same agency shortly after that. Safety plans. If any of you are in child welfare or child welfare adjacent organizations, you've heard that term. Safety plans are a contract, so to speak, between a caseworker and a family that has come into our system. And it says things that are supposed to mitigate risk, right? And it asks the parents to sign this safety plan and then adhere to it. It's used to try to keep families together. So well-intentioned safety plans. In this same agency, caseworkers were getting frustrated. They went to their leader and they said, these parents aren't following this safety plan. They're not doing what we're asking them to do, so we're pulling these kids, we're putting these kids in foster care. And then the leader heard this challenge, heard these qualms, and they decided that they were going to mandate these safety plans by making a judge sign off on them. They made a decision. They said, okay, let's have the judge sign these safety plans, and now it's a legal document, so to speak, and they have to do what it says on the safety plan. If you know anything about safety plans, they're usually not sent through the court system. We're trying to be more collaborative. We're trying to have this voluntary understanding of our support for the family. As you probably can imagine, parents being faced with a now legal document wasn't received very well. Let's talk about the fact that that was an adaptive challenge and one leader made a choice and provided a solution. But again, adaptive challenges require much more than that. They require presence, time, communication, and trust. Some adaptive challenges require pulling together a work group. Okay? Some adaptive challenges require experimentation, but they do not require a leader putting their gavel down and deciding what's next. This part about the people with the problem lead the work. Okay? A true leader, a courageous leader that's trying to change a system, they know how to say, okay, I hear your problem. Okay. Let's get around a table and strategize. Let's ask the hard questions about when you build this safety plan, are you building it with the family? Are the things on the safety plan relevant? Are they feasible? Are they culturally sensitive? Did you have a level of humility and partnership? Last time I spoke for All for Kids, we talked about power imbalances. Did you share power? Or did you wield the power that we all have as a system? Okay. So again, this segment is really to consider what is a technical challenge, what is an adaptive challenge? If leaders continue to confuse these or continue to use their power to dictate how we provide solutions, we can't move our system forward. And we also can't understand ostracized communities of families of color if, again, we're just putting blanket solutions over certain challenges. Adaptive challenges require, like that what was said earlier, talking to the community you're working with, listening to the community members, working as a team. Before we move on to the next slide, I do want to do a quick poll. Okay? If you were on the last webinar with me, you know I use mentimeter.com. Okay? So if you have a cell phone, or you can also use your computers, I want to hear from you about technical challenges and adaptive challenges. Okay? So mentimeter.com is menti.com. It's menti.com. And I'm going to stop sharing and pull up menti.com. When you get to menti.com, it's going to ask for a code. I'm going to give you the code. Okay. So the code is 13687186. And I think last time they dropped it in the chat, but I'll repeat it. And when you get to this code, when you get to the screen, it's going to ask you 3 questions where you will put if you strongly disagree or strongly agree. 13687186. It doesn't have to be your current leader, but consider a leader of an organization. And you can also ask yourself this based on yourself. This is all anonymous, but give me an idea of if your current leader or previous leader or you as a leader, do you clearly distinguish between what's a technical problem, what's an adaptive problem? And then also, is your current leader or your previous leader or yourself, do you address each problem with the most effective approach and solution, meaning your current know-how, or do you explore learning new skills and challenging your belief systems and challenging your values to really do this together? Or thirdly, I clearly see the difference between a technical problem and an adaptive problem and how they require different approaches. Give me an idea of if you strongly disagree or strongly agree, so I know about where this information is landing. And I will wait a few more minutes as folks are still putting in their results. And as you can see, it populate as folks are answering. So it looks like it's somewhat, for the first 2, it's definitely somewhat agree, kind of right in the middle of the road, which is what I usually see. Okay? I hardly see someone saying, oh, my leader perfectly distinguishes, or my leader doesn't at all. And it looks like for the most part, we're closer to agreeing that we understand there's a difference between the problems that we face as a child welfare system. Some of them require top-down, very simple delegation, and some require a much more nuanced approach. I'll wait a couple more minutes. If you haven't put your results in, continue to put them in. Even after I click off this screen, if you still send your results in, it's extremely helpful for me to know how this info is landing and to hear, your perception of your leadership. Okay, all right, thank you so much. Again, please continue if you haven't done that yet. Feel free to continue to put your thoughts in, and I'll go back to my slides. All right. So now that we've talked about challenges and courageous leadership, adaptive versus technical, I want to talk about what leaders do. Okay? If we're truly interested in building a child abuse prevention framework with a race equity lens, what do courageous leaders do? What we just said. They effectively distinguish between a technical problem and an adaptive problem. Number 1, it's important to know what you're facing and how you address it. The next one, they share power with their team, which models what our system should be doing with families. Okay? They share power with their team. Thirdly, they constructively raise the heat. So I'll stay on this for a moment. So most of the time when you're a leader, you're taught and you're trained to cool things down. If things are getting heated or riled up, us leaders we're shown to, how do you, keep things at a low, even keel, right? If there's an issue, we put the issue out extremely fast, right? But courageous leaders don't just want to cool things down. They want to raise the heat. So some of you might be responding with, I don't want to be that kind of leader. I don't want to constantly be heating things up. But the key word is constructively raise the heat. Right? Here's an example of how you constructively raise the heat. And when I say raise the heat, it's not run away from discomfort. So when you constructively raise the heat, you could do this. You could talk about something that's usually status quo. You could bring it up in a staff meeting or with a work group. Talk about something that's going on. Again, I'll go back to the beginning of this call. Acknowledge what's going on in the broader community. Acknowledge what's going on to a certain racial subgroup. End Asian hate. Black Lives Matter. That's how you raise the heat. And then you do it constructively by allowing your team to sit with the discomfort, talk through it, be solution focused, sit with the discomfort. Leaders that never want to bring these types of things up, they're leaning into the status quo of leadership. They're cooling things down. But it's important for a courageous leader to constructively raise the heat. Brave leaders also remain steadfast and mission-driven through uncertainty. When you are talking about child abuse prevention, in particular primary prevention, there's going to be some uncertain times. Lots of heat, lots of adversarial type of conversations, because for some reason, when we start saying, let's support biological families and strengthen them to stay together, some people hear you say, let's leave kids in unsafe environments. So it's important as a leader to articulate what we're really saying and be steadfast and mission-driven. The last one on here, brave leaders, they write their values in cement, even if their strategies and goals are written in sand. Okay? So I tell folks all the time, our strategies to get to where we're going as a system, they might vary. They might vacillate, they might even oscillate. We experiment, right? Adaptive solutions are often experimentation. We carefully and comprehensively experiment on what might be helpful for our families and helpful for our strategies. If we start to really realign our values and cement them, put them in concrete, what if one of our values was protecting relational connections? If that was a value of our system, we're going to protect a child's connection to their biological families through their nuclear family or kinship care. That is a value of ours, and it's cemented. So all of our strategies, although they might shift and change, they all are leading us to that value. What if we cemented our value of anti-racism? All of our strategies, all of our efforts, all of our meetings, all of our new policies are leading us to our cemented value of anti-racism. What if our value that was put in cement was primary prevention? How would that change our funding streams? How would that change how we approach our work? If one of our values was finding a way for families to get the help they need without scrutiny, without shame, without being put through our child welfare system. Okay. As many of you know, over 60% of the cases we see in child welfare come in because of neglect. And disproportionately, those numbers are Black and brown communities coming in because of neglect only. I don't say neglect only because it's simple and it isn't a big deal. I say neglect only because this is a lot of the times purely because of a correlation between impoverished and protracted impoverished communities. Consider that as a leader. Consider as we move toward prevention and we talk about race equity, cementing our values, okay? But being open to experimenting on what those strategies might be. And if something's working, let's keep moving forward and let's be fallible, because if it's not working, let's not use it anymore. Let's not continue with the status quo and doing the same old strategies, the same old thing year after year. We have to be keen to what's working and what's not. Okay? What do courageous leaders do? We just did our poll for that one. So some of you were on the call, the last webinar we did, and we're going to talk about mindset. Keep that in mind when we talk about leaders, because I want you to consider your leader and what their mindset may be, but also what yours is. So ask yourself, who are you? If you're familiar with this framework from last time we spoke, I want you to consider how this coalesces with leadership. So the first type of mindset is segregationist. And some of you might be thinking, oh, we don't have that type of mindset in child welfare, or, but we do. And as we talk through this, you might start to recognize someone you know, or someone you work for, or someone you used to work for that thought like this. They believe that these people cannot be helped. These people are the folks in our communities, many of them Black and brown and struggling through material need and financial insecurity, but they believe they cannot be helped. They believe we must save these people from themselves. They're very punitive minded. They blame families for oppressive systems that have contributed to years of racial and social disadvantage, yet they blame families. Segregationist leaders believe that these families are permanently inferior. Let's talk about assimilationists, okay, which many of us might fall into this category because our curriculums, our training modules, a lot of our mindsets are assimilationist oriented. We believe these people can be helped in contrast to the segregationists. We believe we can help them become more civilized and more educated, right? We believe there's a standard, often known as a standard of whiteness, that these families need to reach, and we're going to help them reach it. I was on a call in New Jersey on a webinar, and someone raised their hand and said that they built a case plan with a mother, and it was a requirement that she get her GED. So again, is anything inherently wrong with getting a GED? No. But the fact that we were requiring that means there's a level, an assimilationist mindset. There's a level of a standard we want to require, and also known as make this person meet. A segregationist blames families, but an assimilationist, many of us want to save families. You might have heard someone say they came into child welfare, they came into this field to save children because they only believe you're temporarily inferior. Think about how you were trained when you came into your job, how you were educated in your educational institutions. Many of that is assimilationist. Now, lots of us are trying to make this systemic leap to anti-racist, right? A segregationist believes these people cannot be helped. An assimilationist believes these people can be helped, but an anti-racist believes these people are people. They're already civilized. They are inherently valuable. They have worth already. They focus on reducing inequity and creating equal opportunities. A segregationist blames. Many of the folks in our system are focused on saving, but an anti-racist liberates families from oppressive institutions, okay? Because families were never inferior. Again, an anti-racist has a lens of understanding the decades of oppressive institutions, systemic racism, systematically creating disadvantage for some folks in our communities. And they're aware of that. So they focus on reducing inequity and strengthening these families, okay? That is the mindset shift that we're all trying to make as an organization. We have to consider where our leaders are with their mindsets and where we are as folks that are often doing the work on the ground. Okay? Who are you? Okay. So now that we've talked about what is prevention, we've talked about systemic change, leadership, and what is the mindset of our leaders, I want to take us through a framework that we're trying to build out. Before we do that, we'll talk about courageous conversations, which lends itself to how we went about our framework. Lots of folks ask this question: how do I discuss this topic? Okay? How do I bring up these uncomfortable things that I'm noticing or observing? So I've compiled some, as I call it, hacks that might come in handy based on the questions that I get from. For example, this policy does not impact all families the same. I'm advocating for an exception for this family. I'd also like us to review this policy as an agency because it negatively impacts Black families. I can take lead on convening a work group for review. This could be from a caseworker, or it could be from someone who started to observe a policy and its impact on a certain family. I want you to realize they asked for an exception, right? People that don't understand equity versus equality would have an issue with this exception, right? Think about the last time someone said, can we not do that for this particular family? Someone may read that as, you may have heard the term reverse discrimination, that we're showing favoritism toward a certain family. I would like to offer up a term called anti-racist discrimination. And I want you to consider that term. What is anti-racist discrimination? It's a focus on equity. It is making exceptions for families that are being disproportionately and negatively impacted by our policies and by our procedures. So consider that next time someone offers up, we can't make an exception for that family. We have to do this for every single family. And we know what we do for every family is equality, but that's not equity. The next example, I've noticed a pattern in our court hearings with Black parents. They rarely have adequate representation, which is creating a power differential that will almost certainly lend itself to their disadvantage, said by an attorney that spoke up, that constructively raised the heat. An attorney started to notice a pattern in the courtroom and said, we have to do something different, okay? Third, I hear your position on this family. Can you tell me more about why you felt differently with the Ross family from last week? These families are very similar besides their ethnic background. This is a caseworker perhaps talking to a colleague. They saw a difference in disparity and a difference in their decision. That's also constructively raising the heat. Not easy to say, but notice how they said, tell me more about that. They're inviting a conversation. I get lots of questions now from therapists that want to bring in an anti-racist lens into the therapeutic setting, which has largely been vacant of that. Here's an option for a therapist. There is so much going on in our country right now, and much of it is about racial tension. What parts have you been paying attention to? Or what from the media has been on your mind? It's simply, I'll use that word, acknowledging what's going on with the child in your chair. Okay? Lots of therapists don't acknowledge these things if they're sitting in a room with a Black or brown youth. So that's an option for someone who wants to at least open up the opportunity to discuss these types of issues. I get calls and emails from foster parents and adoptive parents that say, I want to bring an approach of anti-racism to my work. They don't typically talk about these issues if they have a Black or brown child in their home and they're dissimilar racial groups. Here's an option for you to talk to a child who's of a different race than yours. Can you tell me about a time where you felt the most seen and where you felt your voice was valued? I'd like to do my best to create space where that continues to happen. We talk a lot to youth in our state here in Florida, and we ask about this very thing. Lots of things come up, and one of those is feeling invisible, not feeling seen, having someone look at them and not see their color, which is really dehumanizing who they really are, right? So that is what we want to eliminate from continuing to happen. So asking a child, of course, it depends on how old the child is and their verbal skills, but asking, when's the last time you felt loved, seen, valued, and making a mental note to try to recreate that while they're in your home. Okay. And lastly, this African-American mother has been trying to secure housing for her children for the past year. She's moved 3 times due to certain restrictions. We threatening to take her children is cruel. Let's figure out another way. This was actually said in a staffing of other colleagues by a caseworker. And she said that term cruel kind of stopped everyone in their tracks. To me, she constructively rose the heat. She asked them to consider the fact and what this family had already been going through, and then to find another way, to deviate from policy, to figure out how to strengthen this family with a racial equity lens. For the last year, we've been talking to leaders in the field that have been doing this work well before May of 2020. I know what happened in May of 2020 had folks springing forward to bring anti-racism into the fold. But I spoke to leaders that have been doing the work for years and sustaining race equity work. And I used their insights to try to build out a framework of prevention and race equity. And I want you all to hear some of the insights from the field. So we pulled this quote pertaining to training and ongoing coaching. A respondent said, initial training on disparities and race equity and the history and creation of systemic racism is important. However, ongoing coaching and courageous conversations, like we just talked about, and peer accountability is even more crucial to that shift. We all revert to the default button when things get tough or uncertain. It's through the ongoing confrontation of our bias and the infusion of parent voice and constituent perspective that leads to practice becoming anti-racist. Lots of things in that quote: courageous conversations. When the going gets tough, we usually default, right, back to what we already know instead of continuing forward, staying mission driven in tough and uncertain terrain. On leadership fortitude, a respondent said, I can't go forward and do this work if the minute something bad happens, which would have probably happened anyway, my team acts as if they weren't a part of the work. I need support and for people to have my back when and if there is an undesirable outcome. And we'll touch on more leadership fortitude in a moment, but we need courageous leaders, but those brave leaders that stand up and say something is going on in a community and we need to do something about it. They also need support when they make that stance. So it takes bravery, but it also takes us to rally around courageous leaders to build up their fortitude. On shifting mindsets, a respondent said, we realize that what it really takes is prioritizing race equity is to change our mindset. We just talked about differing mindsets, right? It was about us. It had nothing to do with these families. It had everything to do with us and our judgments and our biases and how we use those things to make decisions for removal or ongoing monitoring services. The more we worked on changing our mindsets, we realized it was just like peeling an onion. There was just more work to be done. Okay. On courageous conversations, a respondent said, ongoing coaching sessions have been an opportunity for team building. It has created a safe space to say things like, I have a problem when I go into a home and there are public assistants, but mom's nails are done. It's okay to say that out loud. Acknowledge that's how you feel, because if you don't, you can't pretend like it didn't bother you. You have to say it out loud and then be held accountable. Now there's group accountability. I know that you all have some learning exchange opportunities coming up. And I want to encourage you to build team accountability, create a safe zone to say the things you believe and feel. That's how you change your mindset. If you never acknowledge what your mindset is, how will we change it? On collaboration, our attorneys have been the most challenging population in the entire system because they're very punitive. There's an idea that the family did something wrong. There has to be a punishment. People deserve opportunities. People deserve a second chance. People deserve for you to have hope that they're going to get better. Our families, especially in this area, are already have so much up against them. On the approach, on the anti-racist approach, how do we go about it? The respondent said, I always tell folks in this work, you have to take a multi-dimensional systemic approach. You cannot do one thing without the other. You can't just focus on legislation without influencing your organizational policies and without addressing your frontline practice. You have to do all three. And there's probably more than three. So with that being said, I want to show you, and this is a draft of the framework that we're building out. And I'm excited to share it with you today. So as we said, things usually start with courageous leadership. It starts with one person, maybe two, saying something is amiss, okay? We have to do something different. Constructively raising the heat. That starts here. And then usually training starts. And what this framework is an illustration of what these leaders in the community told us has worked for them. Training came next. Reorienting yourself to understanding history and understanding the embeddedness of systemic racism in the systems where we work. After the training aspect, there was this segment of community needs assessment, understanding your community. Some of them did a formal assessment where they sent consultants in the community. Some sent their colleagues. Some had families doing surveys so they could truly understand what families were facing. Some folks reported doing an inventory of services after that needs assessment, understanding what services are available to families. and making certain that their inventory, their lists of resources were up to date regularly, keeping them up to date. Now, after the community piece, we had leadership stand up and then training happen and then a community push of understanding what's going on. Let's go to this middle area. Then there was this cross systems training and ongoing coaching piece for these leaders in the community. They had to bring their community members and community partners to the table to learn with them. And then they instituted ongoing coaching, sometimes using a consultant, but sometimes building capacity in their own organizations for ongoing conversations about this topic, keeping it at the forefront of their minds. Collaborative learning, bringing teachers together, bringing emergency room physicians that call in child abuse reports, bringing in law enforcement to the table to learn about race equity and prevention and anti-racism. And after they did the collaborative learning piece, these leaders reported this is the programmatic changes took place. They implemented strategies in this next realm. And then leadership fortitude. Although we had to start with courageous leadership, every single one of them reported. After we started making those changes, after we started making these bold anti-racist changes in our system, the fortitude was needed. We needed support. We needed an atmosphere to talk about the tough terrain of change for brave leaders. The next slide is going to talk about some examples of programmatic changes that some folks reported. Some of them are doing parent partners, where parents that were in our system and had lived experience are now a part of our system, helping other parents get through it, partnering with them on this journey. Some folks are implementing blind removal meetings, not to be confused with colorblind policies, but simply saying when we decide to separate a family, we're going to do so without knowing their race, without knowing their socioeconomic status, without knowing what neighborhoods they live in, an option for some agencies. Some folks are doing family group decision-making, bringing moms and dads and aunts and youth to the table to make the decision together. Some folks are formally slowing down the process of family separation by bringing layers of approval, saying you can't separate a family without going through these, as some folks call it, hoops to jump through, just so that decision isn't made so easy. Of course, if it's an emergency situation, they address that during that time, but lots of our decisions can be slowed down. So we're very meticulous and comprehensive, right? Project GAIN was a strategy used in Wisconsin. GAIN is an acronym for Gaining Access to Income Now, for families that were coming in due to purely neglectful situations where they didn't have financial security. So GAIN was a process they went through where they got an infusion of cash, they got financial literacy training, other mental health concerns, and access to certain services. And then they followed these families to make sure they didn't recidivate back into our system, and they did not. Another option for changing your programs or implementing strategies is setting measurable goals. Some folks said, now we're going to say we have 300 youth in group homes. By the end of this year, we want to cut that in half. They set very measurable goals and work towards them collaboratively. Some folks have instituted accountability questions, like, are we punishing these parents? Are we protecting ourselves? Are we protecting the child? Those are questions they really wanted to ponder before they made certain decisions. Okay, these are just examples of folks in the field and what they've done. All right, so we also asked these leaders what is essential for engaging in anti-racist child welfare practice. As we already discussed, training. That was essential for them. We have to have a baseline understanding of what has happened historically and how we're continuing that in many ways and how we have to change. Training isn't the panacea and we can't stop there, but these leaders said they started there. The next one on the list that really bubbled up was community needs assessment and collaboration in the community. A close third was that cross systems training and education. Not only telling our child welfare agencies about anti-racism, but talking to principals and teachers and doctors and nurses. So we all have an understanding in our community what's impacting these kids and their families. Another one was also essential to do was review your policies and how they impact certain communities. And then number 5 was now create anti-racist policies and procedures and new ideas that are trying to liberate families. Okay. And number 6 was quality legal representation for biological families, making certain that if we have an attorney for the state and an attorney for our child's welfare system, that parents that are facing losing their kids or parents that are facing being pulled through our system for 12 to 15 months, that they have quality legal representation, that is going to be crucial to doing anti-racist child welfare practice. I hope I'm good with time. I was hoping I'd talk for about an hour, but now that we've gone through those, I wanted to save some time for questions if you have any. So I'm going to stop sharing and come back into the webinar room and we can have a chat. Thank you for your time and attention.
Thank you so much, Dr. Price. That information is very helpful, especially for folks who don't know what steps to take to start to change systemic and oppressive systems. So um, we welcome you to enter any questions that you may have now into the chat box, and I will read those out for Dr. Price. Lots of valuable information and also very, very timely and I think something that is very needed right now. I know someone had mentioned earlier wondering about how do you get, I guess, people on board with making some of these changes or even recognizing that there's an issue in the system, because sometimes what we see is, people will say, oh, well, the system over here is oppressive or is racist, but not knowing that they may be a part of that. And I think that sometimes it's hard for folks to rectify when you're in a field that's supposed to be helping people. And I think it kind of brings it back to something you said at your first webinar with us of, intention versus impact. So I know I kind of added a lot of things into there, but is there anything you wanted to kind of speak to that kind of intention versus impact?
I can speak to it by saying, we just did an op-ed, and I might have mentioned this before, but we talked about the importance of acknowledging that we've had some missteps, even though we were well-intentioned. These are the outcomes. So it's hard to deny that there are disproportionality and disparity in our system because we have data to show that. And we also have qualitative data of folks that have responded to us saying how our system shows up and how our system, we just did a project here in Florida where one of the themes that came out of our parent groups was dehumanization, how they go through our system, but they feel dehumanized. So we have to value their story and their perception of how we're showing up. So I'll say folks that are saying, how do I get folks to understand there's a problem? There are many ways, but one of them, and one of the ways that I would say the safe way is to show them the data because it's there. And then secondly, I'll say storytelling is powerful, and there are some incredible stories out there that we have to share with folks, especially if we talked about power dynamics last time we met. I tell people that say, I want to share power, but my boss doesn't. I say, share power and then storytell. Share power with a family and then tell a colleague how you humanized this family and how the outcome, what was the outcome because you shared power, and then share that with another colleague and then the three of you share it with your manager. That's how you share stories of you've changed your approach. You share power, you're focused on equity and liberating folks so that they can take care and strengthen their own families. We want to liberate them from the multiple intersections of inequity. So I would say focus on data and then also focus on telling the stories of how these new approaches are making a difference in the lives of our communities.
Great, thank you so much. Maria Duarte had a question about if there was any community assessments out there that organizations can use.
I'm sure there are. And if you're referring to the folks that talked about that community needs assessment, I can definitely reach back out about, I know a couple of them made their own assessments, but I think you're asking about, is there a standardized, and I'm sure there are. But the two folks that mentioned their assessment, they created them in-house and used that to really figure out what are the needs. They also created those assessments with the help of community members. So if you were interested in creating your own needs assessment, it might be a great exercise to bring in some folks with lived experience to know what questions to ask. I see the question from Sarah.
Yes.
So there was one of the respondents in our project. She asked about more information about the assessment collaboration process. They wanted to be very keen on what community gaps in services were. Okay? So they created a questionnaire for families in the community. And they asked questions, for example, if you were having issues meeting your rent or paying your light bill or electricity bill or utilities, where would you go? What is your respite if you need, help with your child care? So they asked questions about families if they were in need and where they go. And then they started to really analyze where are the gaps and what's missing. Okay? But they also asked things like, what services have been helpful, because they wanted to know what's helpful so they could try to increase resources and continue to bolster that part of the community. So not only were they looking at what don't we have, but they wanted to know what do we have. In our child welfare agencies, if we're not keen, if we're not understanding what our community members are dealing with, we are going to come at them in a way of, why aren't you doing better? Not understanding what situations they're facing. So I believe that's why that bubbled up so much in our study. The reality that if you understand the issues of your community, you're going to have a level of empathy when you meet families when they come into our system.
All right. And then there's another question from Deborah Thomas. How do we address implementation problems that just state data reduce number of children in group homes, but no real plan of training for implementation? Train specialized homes first, for example.
I'm going to try to look at that again.
Yeah.
How do we address implementation problems that state data reduce numbers of children in group homes, but there's no real plan of training or implementation? Deborah, I don't quite know. I think I know what you're asking, but if you want to write more in the chat to clarify, that's fine. But what I will say about that is something that's connected to here in Florida, in our group care system, we're trying to create quality group care standards. So that might be something that's helpful, and I can provide information on that. The idea is really to have standards across the board for our group care facilities. And in order to get licensed, right now in many areas of our country, you get licensed for your group home by checking a box, meeting certain criteria. But here in Florida, we want to not only require certain criteria for licensure, having a building, having certain number of rooms, having things like that. We want to have certain quality standards before you can even get licensed. And then we're training folks on how to continue to build quality in their group homes. So thank you for your question, and happy to continue that if you want to provide more clarity.
I think Deborah's off mute, so maybe you can clarify.
Myself, what I was asking was, here in California, we often have an implementation. We're going to close a certain number of group homes, limit a period of time that children can be there. And that date comes, that group home is closed or there's a change. The placements for the children are not, we don't find placements for the children. We don't train the caregivers to the level of being able to handle children that were formerly in a group home. And it ends up a disaster where we cannot find effective placements for children in the community. And this has been an implementation throughout the state of California, time after time after time. And so I was wondering, how do we address something like this, where in the year before they may close a group home, or reduce the population, that there is actually real life training of this is how you work with a particular population?
So, not knowing everything about the situation, it sounds like it's an adaptive challenge that was met with a technical solution. So, and that's what I'll offer up, because I encourage you and your team to think through that framework about technical and adaptive learning and solutions, because that is a big issue. And it sounds like you said, somebody created a data point and they said, implement this, close these group homes. And that was kind of the law. That was kind of what we're working towards. And that's not the way you address an adaptive problem of overcrowding or excessive youth in group homes. So I would say that issue is happening because the leaders didn't really take an examination of what the issue is and how to learn new skills, like what you're saying. When there's an adaptive challenge, it requires new skills, new trainings, new understanding of the population, new understanding of those communities before you set a measurable goal and tell your workforce to meet the goal, without, again, looking at your values, looking at your habits, looking at the status quo, and making very deep and meaningful shifts in how we're approaching the issue. I appreciate you bringing that up, because it is another example of, again, the misalignment of a problem versus the proper and most effective solution.
Great, thank you so much. One question was, how do you provide more access when lack of funding is provided as the barrier? So an example would be to provide additional bilingual staff or translated materials since they don't have the funding. I just wanted to make a quick comment about that too, is that, anti-racism in this work is also beyond that. So I want us to also think about, what kinds of other things can be done in your systems beyond that, right? So sorry, go ahead, Dr. Price.
Sure. So I appreciate the question, and it reminds me of other questions I get that say, we want to share power. We want to provide resources for biological families. We want to prevent them from coming into the system. We want to eradicate systemic racism, but our communities are under-resourced and our child care centers are full and we're out of vouchers. And, so I get the difficulty in wanting to provide resources, but then funding is an issue. And that goes back to something I talked about at the first webinar, the idea that you can't do one thing without the other. It has to be comprehensive. And I'm not naive. I know that we can't meaningfully promote prevention and effectively eliminate disparity if we're not talking about resources and finances and moving resources around. If we talk about we need to get upstream, but we're not appropriating money for the upstream families that are struggling and families that are, wading through addiction and mental illness, then we can't talk about being upstream. So I empathize with your question because it comes up a lot. And my answer is we have to have a conversation about well-resourcing our communities so that we can have child abuse prevention, providing more resources to our communities so we can strengthen and liberate Black and Brown families. So if people are talking about this topic and not discussing that, it's an incomplete conversation.
Great, yes, I agree with that. Another question is, when looking at the data, what sort of data is optimal for shifting systems to more anti-racist? So, what sort of data do you feel like is most helpful?
If you're asking what data someone should use if they're trying to start the conversation, we are talking about how Black and Brown families, how likelier they are to be visible by mandated reporters. So they're getting more reports called on them. And then we're talking about, of course, we hear this all the time, the disproportionate number of them in foster care. So that data point is important. We've talked about and learned about the trauma of family separation. So the fact that they're overrepresented in foster care, another data point. There's also data points around once they're in foster care, they're in foster care longer, and they're often moved. So there's placement instability. So I would say those are 3 data points. that if you knew the data around them, that could start a conversation about making adaptive solutions to these very, very nuanced issues and challenges that our child welfare system is facing.
Yes. Are you aware of any counties or states who have implemented the blind removal process, and what has been the strengths and challenges they faced?
So it originated in Nassau County, New York, and there's currently a pilot in Grand Rapids, Michigan. So what I hear from some of the folks that are doing this is it did take a while for folks to get accustomed to talking about families without demographic information. But they feel like once they made it over that hurdle, it was impactful to talk about families in a more strength-based way, to not focus on demographics, to not focus on where they live. So I have heard feedback that the conversations are much more capacity led, much more, again, strength based and also resiliency focused. And they're having more comprehensive questions around placement in these blind removal meetings, where if we do feel like there's a safety issue, they're talking about, let's talk about kinship care or familial care placements. That's one thing that comes up of what they're learning in blind removals. Another thing that's coming up in blind removals is the reality that it's not the silver bullet, so to speak. The reality that you cannot simply do blind removals and think you're done with anti-racist work. I tell folks all the time, this is a strategy. Remember the quote, strategies are written in sand. So we're trying to ultimately transform our system, right? So to me, I believe in targeted strategies and universal goals. And our universal goal is to transform our system to be anti-racist, to transform our system so that when a Black family or a Hispanic family or a Native American family comes into our child welfare doors, that we're able to humanize them, see their value, and meet them where they are, co-create a path forward. That's the system we want to build. Until we have that system, we do have to create some level of strategies that nullify the impact of systemic racism. And some folks are doing that by utilizing blind removal meetings.
Great. That's great. Sounds like it's something that can really help bring more equity into the system, but hopefully there are other important things that happened as we start to continue to do this work. All right, so any last questions now that we have this amazing expert here with us today? So before we close out the questions, I'll give us just a minute.
I guess I'll unmute to ask a question of follow-up because I find all of this work so interesting and so helpful. What advice might you give to a county or a county team that might want to try implementing the blind removal process? Are there particular articles they might read or research they might look at?
Absolutely. I wrote an article 3 years ago that I would recommend. It was us going into the Nassau County agency who started blind removals, and we spoke to case managers, their supervisors, their directors, the commissioner. We spoke to all these levels in the organization about how blind removals impacted their decision making. So that would be helpful. There's also a plethora of op-eds, for blind removals and against. So it's a lot of information out there that I think would be helpful for anyone who's interested in starting it. I think it's important to hear the folks that are saying this is not going to work for us, but then hear the folks that are saying this works great for us and trying to decide. We realize how different our country is, right? I live in Florida. I realize how different our region is, from one region to another. So it's important to know what will work for your organization. So I would definitely recommend that. Other advice, I don't usually use the word advice, but I understand what you mean, Sarah. So I will also say be mindful that there needs to be a comprehensive approach. So before anyone begins blind removals, I would tell them to clearly understand how blind removals is fitting into their overall anti-racism framework, into their overall plan to move this topic forward and try to strengthen and liberate Black and Brown families. So that's number one. Before they talk about blind removal meetings, make sure they talk about where it fits, because it needs to be a piece of the puzzle, but not the entire thing.
Great. All right. Um, okay. Well, thank you so much, Dr. Price. We truly appreciate your time, your expertise, and helping us really bring awareness around how important it is to really, start to get racial equity as part of the conversation in breaking down and changing oppressive systems. So thank you so much for that. This webinar will be on our YouTube channel. It will be under our strategies TA, so we want you to keep in touch with us. You can follow us on LinkedIn, on YouTube, on Facebook, and we will also be sending the link out to you all as a follow-up. We also will be sending a SurveyMonkey link that should be dropped in the chat soon, so you can let us know how it went today. We will also, if you don't have time to do it today, don't worry, we'll send it out in also in an email as well. I also wanted to mention, as Dr. Price mentioned earlier, we are having learning exchange cohorts. So for those of you who may not be familiar, it's an opportunity to come with peers who are doing, who are part of child abuse county prevention teams, to come together to talk about child abuse prevention with an equity lens and learn more about equity. So it is participant led, meaning that as participants, you will steer the group in how, what sort of things that you want to learn more of. We will have other peers sharing their work. We will bring in subject matter experts when needed. And just a great opportunity, I think, to really sort of be in a safe space where you can really learn more about this. This work is hard, and it can be very challenging, and it can sometimes feel very isolating. And so we just want to make sure that people have a place to be able to come together and say, how are you doing this? Or, what sort of challenges have you had and what are some of the solutions? I am actually going to drop the flyer for our next Equity Learning Exchange cohort, our first actually meeting, into the chat. I just do want to preface this by saying it is for people that are actually doing child abuse prevention planning. So this will be looking at the work from a more macro level. And then I'm also going to put a flyer that we have that really explains like what a learning exchange is all about, what it looks like, things like that. Before we leave today, I wanted to leave you with this quote. It says, do everything you can to make it around the system, over the system, or out of the system. And this quote is from one of my favorite modern day poets, Tupac Shakur, who really, I think, was so great at really illustrating the struggles that marginalized people have. So please, thank you for joining us today, but please also take care of yourself. We know how hard the last few weeks have been, especially for lots of people of color. We want to make sure that you take a moment, enjoy the sunshine. If you have sunshine, take a walk, take a breath, stand up, stretch, do what you have to do. But thank you again for being part of this conversation. And we are so happy that you decided to spend it with us. So thank you so much. And again, to Dr. Price, thank you so much for sharing your expertise and also your information.
I think that's everything.